Good candidate for a tummy tuck is someone who has loose skin of the abdomen. It could be from after kids is the most common thing where the abdomen gets stretched out. So if there's loose skin of the abdomen, really nothing you can do on your own other than a tummy tuck to get the abdomen tightened back up again. The other candidate is someone whose muscles are separated. Your six-pack muscles run up and down, should be parallel and close together. With pregnancy, we know those muscles have to separate to allow the baby to develop through. Oftentimes after pregnancy, even after the baby's delivered, the muscles never fully come back to the middle. That's called a rectus diastasis. And this is something that's very frustrating because this can lead to a lot of lower back pain because your front core can't really absorb the normal daily lifting forces quite as well. So a lot of those forces get passed on to the back. What we found after a tummy tuck is you're able to tighten the muscles up and you're able to tighten the skin up as well. So not only do you look better, but there's a lot of good functional medical benefits that come from a tummy tuck as well, especially relieving or preventing future back pain. The short answer is that liposuction is a good tool to remove fat. It's not going to do anything to significantly tighten skin. So if someone has good tight skin and just some areas of fullness due to fat underneath, liposuction is a great option for that. Usually that's not the case though, especially after someone's had babies. There's usually loose skin, and as soon as there's loose skin involved in the equation, you need to go more the tummy tuck route because that's what's going to actually tighten skin. Think liposuction to remove fat, think tummy tuck to tighten loose skin, and if there's a combination of the two, it's a tummy tuck with some liposuction added in. There's a big difference in the recovery between those two procedures. The liposuction is done through small little incisions, has a much quicker recovery time. You're back within a few days doing all your normal day-to-day things. You're back within a couple weeks doing all your exercising. The tummy tuck, on the other hand, is a much longer incision, more to heal, more downtime. So you're looking at being at home, out of work, not really doing anything for about 2 weeks while you heal. After 2 weeks, you can start getting back out doing some light duty things, back to driving, shopping, errands, maybe a light desk job, things like that. But it's a solid 6 weeks after an abdominoplasty or tummy tuck until you're back doing high intensity cardio, heavy lifting, weights, things of that nature. Most important thing for a smooth recovery is preparation. Trying to get as healthy as you can, trying to get as close to a goal weight as possible before surgery are two things that are really important. A third one is making sure we're not smoking or using any nicotine or tobacco products at least a month before and at least a month after surgery, because that can cause a lot of poor wound healing or lead to higher chances of infections. So getting your body primed before surgery is super important. As you get closer to the surgery day, I think going into surgery with really high protein levels helps. So I encourage everyone to get on a high protein diet for that month before and after surgery as well. And then just mentally preparing that you have the adequate help set up that you may need in your downtime, whether it's with work, whether it's with kids, whether it's stuff with the house. It just decreases stress levels and makes for a much smoother recovery.